single page exam view is really one of the key features of Doctorsoft that makes it unique and that separates it from the crowd. First of all, the single page exam view is patented by the US Patent and Trademark Office, and as you can see here, it is really an overview of the whole exam. Just like when a pilot goes into a cockpit and he can see everything that he needs to fly the jet, similarly the single page exam view is able to do that for an ophthalmologist when seeing a patient. The way that happens is that basically the whole exam is divided into multiple sections that can all be seen on the same page. In the top portion, basically we have all the demographic information and the pertinent information. Behind the single page exam view, just to give you an idea, is 55 plus pages of information that's consolidated and summarized just to the critical information that the ophthalmologist needs to see the patient and make the decisions. So the next thing is basically a navigation screen, a navigation bar, and then it goes into a section on the complaint and history and medications, and then on the vital signs, the visions, the pressures, the vital signs, the mental status. After that, as we go lower on the single page exam screen, we can see the examination portion, which is divided into the anterior segment examination, the external examination, the anterior segment examination, and the posterior segment examination. And then finally, there's a whole bar that has to do with diagnostic tests, with procedures that are done, with laboratory and radiology tests, and then with prescriptions. And finally, at the end is the follow-up section, and in the follow-up section, one can see what the patient needs for their next visit. At the very bottom, one can basically do a super bill, can also give educational materials, and then also do a letter. And also a visit summary is at the bottom to see all the subsequent visits, to see where you are in the patient's treatment process. So that is a brief overview of the single page exam view that really makes the ophthalmic exam extremely efficient, so that one can virtually half the time that one needs to see the patient and document it in the exam room. Thank you very much.